Nurse Allen coming to you today from Healing Healthcare Training Institute. I talk about all things CINA, all things medication aid, and all the programs that I have to offer. Today I will be talking about the medication aid training and testing. So when you're going in to test for your medication aid, it's a little different. The test is only 25 minutes. The proctor sets a timer for 15 minutes and she sets one for 25 minutes. Now, once she gives you the start code, it's several things that you have to do. So I always highly recommend that you go into your portal and do the practice test that's there. So when you come in to test, you are prepared. Now, all test sites are made the same, but it may be different in how medications are administered. And sometimes you may go in and that person may have a medication cart. Some places may have like the little tabletop medication cart. It is your responsibility to learn each cart when you go in and listen to the proctor's instructions on how and where to find your medications. It may differ in how you open and close your MARs. It depends on some patients. Some places have like a piece of paper that they put over it, like a HIPAA compliant sheet that you put over it. Some people may use a little tab just so when you close it and open it, the tab or the computer doesn't close. So you want to follow the proctor's explicit instructions on how to open and close the MAR so that you don't run into any issues with doing your skills. Now, once that's established, she's going to tell you everything. You're going to know where all your equipment is, how to use everything, and then she's going to tell you your actor. And generally the actor is a real live person. That person's going to have on a wristband. So you want to go in and you want to do your checks. How many checks do you have to do? You're supposed to do your 3 checks before you start even administering the medication. So soon as you open the MAR, you should be checking your MAR and saying what that medications are, identifying all your medications, the patient's name, and all medications given at that said time. So if your proctor says that there are 9 o'clock medications given, you would be locating all your 9 a.m. medications and explaining and going through your steps on the first check. Then once you identify everything that you have to do, let's say you have to do a pulse ox on one of those medications. Before you pull that medication, you want to make sure that you did your pulse ox, and if it says below, please hold. If it's below 60, you're going to follow all parameters. Now, for testing purposes, if you do have a candidate and they have an actor and their pulse rate is below, we probably would have you do something different because we want to give all your medications during the testing. So if that happens to be the case, you probably would have to speak to the proctor and see what her instructions are in terms of if we're going to hold that medication or give it, because we have to document the time that medication was given, and the pulse rate. We have to do it as the proctor has to do it, and also the RN observer, she has to put in what she identifies. So once you guys manually take that pulse and she knows what it is, then we're both going to put ours in the system. She put hers in after you finish. Now, once you've identified that you're going to give all your medications, you're going to do your second check. When you start pulling those medications up to the MAR, you're going to be checking them against the MAR to make sure the medication matches the MAR, and you're pulling all said medications. Before you put those before you even pull and put the medications in your souffle cups, you're going to check them again. Then you're going to do your fourth check is when you're putting those medications back. You're going to check your medication each and every time that you're pulling those medications before and when you're putting those medications back. You want to be verbal and you want to be audible so that the person can hear you. You should not be mumbling when you're talking to the proctor, because she's listening to make sure that you're identifying those medications correctly, because some medications can have similar sounding names and we want to make sure that you're giving the right medications. Now, once you identify and get all your medications, then you're going to get all your said supplies together. You shouldn't have to run around getting everything, and it's not that you couldn't, but it's a 25-minute test, and I see people so many times because they're scrambling, and I understand you're nervous, but you're scrambling. But if you follow a system, you will be successful every time. So once you get you want to get your little privacy cup or your little souffle plate, and you want to get all your supplies and put them on there. So you'll put the medications that you pull, you'll get your water, you'll get your gloves, you've already hand sanitized. That's what the first thing before you even start pulling any medications, you're going to hand sanitize. Now, depending on what the medication that you're given, it may have certain things that you have to do, like check the skin, maybe give a sip of water before eye drops. So whatever your medication that you're given, you want to make sure that you're following the parameters said given, but you want to also give your patient privacy. So when you're starting, before you start, you're going to knock on the door. Just like any other skill, you're going to knock on the door, announce yourself, let the patient know what you're coming and your intentions are. You're going to check her ID, he or she's ID band, and make sure you got the right patient so that you're giving the right medications to the right person. Once you do all your checks, then you're going to still, when you're putting your medications back, you're going to check it again, and you're going to go through the MAR to make sure that you gave all those medications to the correct individual. Now, once it's time to document those medications, you're going to document them on the correct line. I'm going to end up putting a little thing on the screen. I just got to get good at that part. But you're going to put the screen up, and I'm going to show you on the screen what I'm talking about in terms of when you're documenting your medications, depending on if you're using Epic, depending on where you went to school at. Some people do POC. So depending on where you went to school, but because you may work in a different environment, the system is not, it's a little different. You got to click and drag, which is a little different than any system that you're going to use in healthcare. So when you come in, you want to make sure that you click it on the correct time. So if you go to a MAR, and it's no different if the MAR is printed out. If you go on the MAR and you see that the MAR is at 9 a.m., you want to put it directly in that block box where it says the time, 9 a.m. You're going to also initial at the bottom on that said block where it says to initial, and everything should be on the correct date. So when you're doing your medication, you want to make sure that you're doing everything on a correct date. Now, once you've documented your medications, you're going to go down to the bottom, and there's going to be several boxes where you have to have, it's a key legend on how medications was administered. So you're going to find the correct one where you're giving the medications to that particular patient. And once you identify that patient, you're going to initial, and then you're going to type out your entire name. Once you do all of that, you're going to go back up to the top, and you're going to hit the review button. Once you hit the review button, you're going to scroll back down again to double check to make sure all medications were given as prescribed. Now, once you do all of that and you've identified that everything's on the right line, you didn't have to make any corrections, because the one thing, if you make any mistakes and you couldn't, once you hit submit, you can't go back. So I always tell people, when you're in a review stage, take a few minutes to overview everything and triple check to make sure everything was done accordingly. Okay. Now, after you've done that, you can then go back up to the top and hit submit. Once you hit the submit button, you're then going to go to the next item of business. So you're going to have two scenarios. So your second scenario, you're going to go and you're going to hit the next button, and it's going to have another patient, and you're going to go through the same steps that you went through the first time. Once you complete everything again before you submit, you're going to go back and review and check all said meds given, make sure everything's on the right date, the right time, the right documentation, and you're going to go down and make sure you initialed and you signed off on all said medications. Once you've done that and everything looks correct, then you're going to go back up to that top right box, and then you're going to type in that medication. You're going to type in review. I'm sorry, you said type in review. You're going to go back up to that said medication, and then you're going to hit submit. Once you submit that, that should be it. You're going to hit the end button. Once you hit the end button, then you're going to go back up to the top and log completely out in the right hand corner. These are some of the steps to make sure that you're successful in your 25-minute test. You want to make sure that you do everything accordingly. You should be making sure that you're double checking on Headmasters in your portal, doing that practice test prior to coming so that you're aware of how to do things. And don't forget, don't take that proctor's key home with you. Thank you and have a nice day, and I'll be coming to you with videos for medication aid, how to be successful for that, in the other classes that I offer. Thank you and have a nice day.